2.5 units of botulinum toxin is injected into the lacrimal gland, but the effectivity just remains say about 10 weeks on an average or 3 to 24 weeks. So, these injections can be performed in patients where the results, post-operative results of the surgery may not be good, or there is some reason why you cannot operate at present, there may be some contraindication. So, this procedure is botulinum toxin can be used as a temporary measure. Now, there may be patients with punctal stenosis. If you have punctal stenosis, the classical procedure which has been described is the other snip procedures, where you just cut either one wall or two walls of the canaliculus. This is the punctum and you just snip it and open the canaliculus. Provided the rest of the pathway is patent, the procedure works. Instead of doing snip procedures, nowadays people have shifted to a non-invasive procedure, that is insertion of perforated punctal plugs. These plugs are inserted on just OPT basis on slit lamp, and they can be kept for 2 months, and for subsequent to that the canalization occurs, and it has been very effective. Only disadvantage is these are slightly expensive. Now, the canalicular obstruction, once the punctum has passed, we come to the canaliculus, the lower canaliculus and the upper canaliculus. If we have partial obstruction, we can simply intubate and leave it for 6 months. If we have individual canalicular blocks, if the canalicular block is less than 8 millimeter from the punctum, then we have to go for a procedure called conjunctival DCR. If the block is beyond 8 millimeter, we go for a canalicular DCR. Now, the problem with conjunctival DCR is that it is very difficult to first procure the tubes which are used for insertion, and the second is the tube extrusion, which is really a cumbersome problem. Now, this is a conjunctival DCR which is performed by an external route. You can see an opening is created directly through the conjunctiva into the nose, and this is a Jones tube which is inserted from the conjunctiva into the nose, and it